Okay, we're going to get started here. First, I want to welcome all of you to our second webinar. Tonight's topic is CoolSculpting, and I'll give you a little overview of what we're going to do. You can see our patient in the background, as well as some of our staff that I'll introduce you to shortly. But I just wanted to start with a little presentation about what CoolSculpting is and how it works. So, for those of you who don't know me, my name is Sarah Holland. We opened up this practice in July. I've been practicing in the state of Maine since 2006, and before that I was on faculty at Columbia University in New York City. And this practice has been an opportunity for me to bring the technology that I'm most excited about to our patients, and CoolSculpting is definitely one of those things. Secondly, I'm going to introduce to you Katie and Sarah. These are our CoolSculpting specialists. You can see their photos there. You can also see them in the background behind me. They've been getting Michelle ready. Katie is a licensed esthetician. She's been an esthetician for 15 years, and she can you see it now? I just got a message to share my screen. It was much more discreet than me telling you I got the message. And she's passionate about skincare and very knowledgeable about the beauty industry on the whole. And she's also run her own successful boutique spa business in the past. Sarah is a registered medical assistant. Her life education started out with a degree in music, and she was a teacher before she pursued her passion in the medical industry and became a medical assistant. And she is passionate about the surgical aspects of medical assisting, I think. Yes. And then we have Michelle, who is our patient, who's agreed to allow us to film her having the treatment, and then she's also more than willing to discuss what it's like to actually have a treatment. So you'll have an opportunity to speak with the real patient later on in this presentation. So I'm going to now give you some more overview on how this works, and they're going to get Michelle ready for her treatment. So I'm going to stop sharing so you guys can get her ready. So as I said, we're going to have this live demonstration, so you'll see what it's like for a patient actually getting the treatment. We'll talk a little bit about why so many people know about CoolSculpting. It's definitely been in the media everywhere. We'll discuss the details on how it actually works and the best areas that it works for. It actually is approved to treat multiple areas of the body. And one of the things that people always want to know is how long is this treatment going to last? And it's really a permanent treatment. It's permanent fat reduction. I'll review the whole process from the time you call and schedule a consultation, what that looks like, how we come up with the treatment plan, and what the treatment looks like. We'll show you some photographs of actual patients before and after treatments, and then describe why we think you should have your treatments here with us at Holland Plastic Surgery. In the end, we'll get back to Michelle and Katie and Sarah and have some more specific targeted questions to the person who's actually having the treatment today. So CoolSculpting is, probably most of the people on this webinar have heard about it before. It's been around for a few years. It was just taken over by Allergan recently, and they've definitely pushed the marketing for it. So most people have seen it somewhere. The reason I brought CoolSculpting into the practice is it's an opportunity to offer a non-surgical treatment. I am a plastic surgeon, so if someone needs liposuction or more surgical body contouring, we can certainly do that. But most people are interested in procedures with less downtime and less invasive procedures. Everybody in this practice has had nice results with CoolSculpting so far. Some of us have had 4 to 6 treatments, some of us have had up to 16 treatments, but everybody sees a nice difference. And we're all open to discussing the treatments that we've had, as well as we're happy to share our personal photographs, our before and after photographs of our areas that we've treated. The other thing that I wanted to mention is just for being on this webinar tonight, you'll receive a free consultation with one of our specialists, and you'll also be entered to win a raffle for a free CoolSculpting treatment for part of your package, just for being here and learning about this with us tonight. So So we know that CoolSculpting is a proven way to reduce fat. There have been millions of treatments performed around the world, and it's still considered today to be one of the most effective non-invasive fat reduction procedures. It has been named by New Beauty as the best overall fat fighter for 4 years in a row, so it definitely has gotten some exposure. The thing that makes it so appealing is that it's non-invasive, there's no needles, there's very little downtime, and it's FDA approved, which tells you that it's a safe procedure to have. The results are also long-lasting, and that's definitely something that we're all looking for in any kind of treatment, is to make sure that the results we get are durable and lasting. These are some of the things I was mentioning about this specific event this evening. With this webinar, you'll receive a complimentary consultation with me or with Katie or Sarah. You'll also get 15% off of your first treatment if you book within 90 days of today. And finally, at the end of this webinar, we're going to raffle a free cycle, and it will be drawn at the end of the presentation. And I'm reminded to tell you that you must be present at the webinar if you want to win the raffle. So back to the media exposure it's had. It's been in tons of magazines, and there's been many celebrities who have promoted their results, including Deborah Messing, who's now the new spokesperson for CoolSculpting, that it's a treatment that's attainable for kind of real people for real issues. And it's really been featured all over the place. And it's been getting, favorable press and really nice outcomes. Whenever I'm looking at a new technology that I'm thinking about offering our patients, what I really want to know is how does it work and how did they come up with it? How was the research done? How do we know that it does what we say it's going to do? Interestingly, CoolSculpting, the whole idea was developed from people noticed back in the 70s there was something called popsicle paniculitis in Mexico, that kids were using, their parents were using popsicles for teething children, and children who were sucking on popsicles for a long period of time were actually getting fat atrophy in their cheeks. That was the first time it was noticed that freezing could actually limit fat cells. It went on from there. Other people started looking at this, and there were two scientists out of Harvard and Mass General that took this idea of freezing fat and figured out this procedure to target the fat cells safely and effectively without damaging any of the other tissues, meaning the skin and the nerves and the muscles that are in the areas. So this was the initial idea, and then the science was taken from there. And this is a good picture of what it actually does. In an area that we're targeting, there's more fat cells than we'd like there to be. The CoolSculpting technology is designed to kill specifically the fat cells. The freezing targets just the fat, not the skin, not the muscles, not the nerves. And you can see in the pictures that the fat cells that are affected by the treatment. And then it takes your body a couple weeks to absorb those and eliminate those cells. Because you're actually eliminating those fat cells, the results are long-term, and the fat where you've treated is going to stay gone for good. So this is to depict that you have a certain number of fat cells in your thighs and your belly and your arms, and if we treat an abdomen and we get rid of a certain number of fat cells, those fat cells are never going to come back. So as long as somebody maintains their current diet and exercise plan, that fat's not going to return. Certainly if you have CoolSculpting and then you put on 30 pounds, would you expect this area to get larger? Yes, but it's actually different fat cells. It's all these other fat cells that are going to be getting larger if there's a weight change. So the fat stores are permanently reduced. The neat thing about CoolSculpting is it's designed to treat many different areas of the body, and it actually has FDA approval clearance for 9 areas specifically. These are the most popular areas that we're depicting here in these pictures. Under the chin, This is 12 weeks after a treatment under the chin. This area of broth fat is also called the axillary puff, anterior to the armpit on females is a common place to be treated. The abdomen and the flank are definitely in our practice the most common. We have noticed improvements in people who have a cesarean section scar like this, that by removing some of the fat above it with CoolSculpting, you can get a much better contour of the abdomen. Inner thighs is another area that's amenable to treatment. Outer thighs, you can see on this patient the benefit that was achieved after this treatment. This excess fat roll underneath the buttock is an area that works well. The flanks, raw fat or back fat, and then the upper arms is another place that works really well. As I said, flanks and abdomen are probably the most common things in our practices, but all of these areas work quite well with CoolSculpting. So back to how long does it last? The fat cells that are gone for good. One thing to point out is the results. It does take 2 to 3 months to see the results. At the time of the treatment, when you're finished treatment, there's actually some swelling in the areas that are treated that lasts for a week or two. By about 2 weeks is kind of the earliest that anybody starts to see fat reduction. And then by 4 to 6 weeks is when it becomes more noticeable. But for the kind of final result that you're going to get from fat reduction, it's best to look at about 3 months, and that's so that your fat cells are completely absorbed and gone. And again, it's important to maintain your current lifestyle with normal diet and exercise. It's excellent at reducing the areas that we treat, but it's definitely not meant to be part of anybody's weight loss plan. The goal is to target specific areas on people that are at their goal weight already. So how does it work once you decide that you want to have some CoolSculpting done? When you come in for your consultation, we have special undergarments similar to the ones in these photographs, so that we can get a good view of everything that might want to be considered for treatment. And you tell us what your goals are. Everybody has a different ideal of where they want to be in different areas of concern. And we look at those areas with you. There's some pinching and prodding, and we want to make sure that the areas that you're concerned about are areas that we are able to treat with our hand pieces. And we actually map out a plan to get you the results that you're looking for. I always look at this as kind of, there's like the A plan, and then the B plan, and then like the dream plan. And so there's always kind of a starting point of what you're most concerned about, and then kind of, if you could do everything, what would that look like? And we can give you an idea of multiple plans. Each area that's treated, the cycle of treatment takes between 35 and 45 minutes. We have 2 machines here at the office, so we can actually target 2 areas in the same setting in the same time frame. So it is a pretty efficient way to get treatment. So after we've made the plan, and we decided what to do, on your treatment day, you can drive yourself. There's no medications or anesthesia given. You can read, you could be available for work on your laptop, you can relax. We have iPads here with Netflix if you wanted to just relax and watch a movie. But it's not a painful procedure, and once you get the applicators on, it's relatively comfortable just to sit and have the treatment. The applicator is applied. This is what they look like, and they have different sizes depending upon the target area. The applicator has a vacuum that draws the fat into the treatment area, and once we're sure that we have the proper area in there, we turn on the cooling to control, in a controlled fashion, deliver the cooling to the specific fat cells that we're treating. When it's applied, you do feel a little pulling and tugging, but not anything that's that I would even qualify as painful. It's, on a scale of 1 to 10, it's maybe a 2. Like, you notice something's happening, it's slightly uncomfortable, but not pain. I personally felt that kind of between the 3 and 5 minute area, it's a little bit uncomfortable as it's getting frozen. Then after that, it's completely numb. I've actually had 6 treatment areas done, and during all of them, I just literally was relaxing in the room. I didn't feel like I required any downtime after. the treatment, and I personally started to notice a difference at about 3 weeks. So in a couple minutes, we'll get to show you what Michelle looks like. I can see her behind me here. I can show you for a second. She's just relaxing on her machine, hooked up back there. And she looks perfectly comfortable. And if she was going to have some discomfort, it would be early, early now in this treatment. You can see she looks just fine. So what do results look like? This is somebody who had obviously her submental area treated. She had 2 cycles, and this is 8 weeks after her 2 cycles of treatment. You can see a significant improvement in her submental area. An upper arm after 2 cycles, you can see a significant volume reduction in the upper arm. This abdomen, again, like we saw in an earlier patient, this area, which can be troublesome for many postpartum women, responds well to this, to an applicator in this placement. And this is 8 weeks after only 1 treatment. So she had these 4 cycles at 1 setting, and this is what she looks like 8 weeks later. They do make note here that she did lose 6 pounds, which is significant, but you can see that this is not all just attained from that amount of weight loss. The thing that I have noticed that is not necessarily portrayed by the CoolSculpting company is that there is some improvement in the skin tone and quality in the areas where we do fat reduction, especially in abdomens, is what we've noticed in our practice. Another patient who had 2 abdominal treatments. When she first went in, she was interested in these 2 areas here. You can see these are the applicators that were applied and what she looked like 12 weeks later when she was treated with 3 more applicators, and this is 12 weeks after those 2 sessions. So a total of 5 cycles and 24 weeks from her first treatment. You can see the improvement in her contour as well as the skin. This is one of my favorite areas to treat, is the upper back. Women call it the bra fat area. And you can see after 1 treatment, 13 weeks later, the reduction in volume that she's had in this area. Inner thighs, again, another area that's concerning for many people. This is where the applicators are placed, and this is after 5 weeks after 1 treatment. Men, for whatever reason, their results tend to be more, they get more results in a shorter period of time than women, has been our experience. For whatever reason, their fat seems to respond more quickly than in females. This is a male who had 2 treatments on his neck. This is an early patient who had, just 3 cycles, 1 of lower abdomen, 1 of each flanks, and this is him 12 weeks later. You can see a significant fat reduction of the fat flanks and lower abdomen. What we expect every time we place one of these applicators is that it will treat at least 20% of the volume in the area. And so when we talk about multiple treatments, if this person had been a lot thicker, it would require more than 1 session in this area. So each time it's applied, each session, he's going to lose about 20% of that volume. So you can imagine if there's a lot of volume, it can take multiple cycles. This is someone who did have, double cycles for his flanks and his belly, and this is his result 6 weeks later. This is another flank area treatment, just 1 treatment each flank and an 8-week post-treatment. We treated my father early on when we first got these machines in July, and he's 75 years old and in very good shape, but had a little excess back here, and he had a very dramatic reduction, pretty much exactly like this. So it's not really age dependent as some of the other technology is. And these are patients in our practice, CoolSculpting of the flanks and the bra fat area, and this is 8 weeks after 1 treatment. And then a flank treatment, 8 weeks after 1 treatment. So you can see how well it works. And then the question is, how long does it last? Like we explained earlier, with the physiology of it, is those fat cells are gone for good. So they're not going to come back as long as the weight is maintained. This is a year after a second CoolSculpting treatment. And then this is showing that 6 years later that result is maintained with 2 treatments on the flank and maintenance of that loss of volume for that 6-year period of time. So why our practice? We're the only facility in Maine where our consultation and treatment are supervised by a board-certified plastic surgeon. Why I think that matters is because if you're not a candidate for CoolSculpting, there are other modalities and technologies and surgical options that may be able to target the areas that you're concerned about. So it's not a one-size-fits-all that we can treat everybody for everything with CoolSculpting. We have a nice, comfortable atmosphere here. Sarah and Katie will make you feel very well taken care of and comfortable while you're here. We have 2 machines, which makes it much more efficient to get your treatments done if you can treat 2 areas at the same time in half the amount of time. We're certified by CoolSculpting, and again, we can provide alternate treatments if CoolSculpting isn't the right treatment for you. So let's talk about how this is going for Michelle. And let me see if I can make this bigger, perhaps. There we go. And does anyone have any questions for Michelle? If you have questions, you can write them in, and either Ashley will deliver them, or I'll see if I can read them. Looks like there are a couple of questions. Let's see if I can figure out how to answer one. Okay, hopefully you guys are seeing the pictures by now. What else? Let's see if I can move this out of the way. Okay, is there questions? Are you feeling cold outside of the area being treated? That's a good question. Do you feel any?
Not at all.
No.
No, just these specific areas being treated, and I've got blankets. And
Yeah.
But room temperature, I'm fine, and where we're working is limited to that area.
Yep. We do have, you can see that she's bundled up in a blanket. She also has a call button, which she doesn't need because we're all sitting here with her, but there's a call button that that a patient would have so that when we're not in the room, you can call us if you need anything, if you're too cold or you're too warm. When a patient's being treated, there's also a beeper that we carry on us. Katie, you can see actually both of them have a beeper. So if there's anything that should go wrong with the machine, or if the machine doesn't feel like it's cooling well enough, or anything like that, it notifies us, and we can make sure that everyone's getting an optimal treatment from beginning to end. We usually, check on someone, I don't know, 2 or 3 times in the middle of their treatment anyway, just to make sure that someone doesn't need a drink or they're comfortable. Another question about skin. Someone's asking about how much can you expect the skin to shrink. Really, we can't expect the skin to shrink. CoolSculpting is specifically made for volume reduction. It's very good at what it does. It's very good at getting rid of fat volume. It's not meant to tighten the skin envelope. So if there's a lot of excess skin, then there's some other procedures that we would consider, such as direct excision or ThermiTight, which is a radiofrequency treatment that can be done underneath the skin to help tighten the skin. CoolSculpting is specifically for excess fatty tissue. It's only targeted to treat those fat cells, and that's all it does. So that's a good question. Someone pointed out that there aren't a lot of patients with saggy skin. That being said, in lower abdomens, we definitely have seen some improvement in skin tone and skin quality. Does it shrink the skin envelope? No. But there's some improvement in the skin tone in those areas that are treated. Any other questions? Did you have any pain when the treatment started?
It felt cold and a little achy in terms of being cold, like putting my hand in the freezer for a few minutes. But it's subsided, and I really don't feel much of anything right now.
Yeah. Yeah. In my experience, it was kind of like almost like you were going to get a cramp somewhere, but then it goes away. Like
yeah. I guess that's
yeah.
a good way to describe it.
And then it just dissipates, and you really don't feel anything.
Oh yeah, and it wasn't so much that I wasn't able to focus or have a conversation or enjoy something to drink or
Yeah.
play on my phone, whatever. It's pretty
Good.
helpful, yeah.
Good. And do you mind telling us, because you've had another treatment area in the past,
I have.
what your experience was like, and how long did you feel like you stayed swollen?
The swelling, I noticed probably right away. It was swollen for a week or two, and then it started coming down. And for me, at about the 7 or 8 week mark, I can start to see a difference.
Mm-hmm.
But at the 3-month point is when I could really tell that I didn't have the fat that I had before.
Yeah.
My concern was putting a shirt on that was tight-fitting or a bikini top. I had those bulges in the back, the fat pads,
Mm-hmm.
and I just felt very uncomfortable wearing a tight-fitting shirt.
Yeah.
But with the point treatment, I feel more comfortable.
Yeah.
I love it.
Yeah.
Yeah.
And that's to me, the neat thing about it. I mean, everybody who comes in here has a different goal. I mean, you just talked about wearing a bikini, your bikini top. Some people have the goal to look better in a bikini top. Some people want to just feel more comfortable in their clothes. It's a different kind of where people target is really different based on your personal goals. So it's not a one-size-fits-all kind of thing. So that's one of the important things, is us being open to what your desires are. Any other questions from the people attending out there? Let's see if I can see any more. Just the coldness. And I don't see any other questions so far. So it's something that obviously you would have again since you're round 2.
Oh, yes, definitely. Right now, it's actually a second treatment because I had this same area done.
Yeah.
I'm really interested in the inner thigh.
Yeah.
Eventually, but I see myself doing this again.
Right.
Definitely.
Yeah. I mean, just as my own personal experience, I'm very into physical fitness. I do a lot of physical activity. I'm careful with my diet. When we first started treating, I was like, oh yeah, I want to treat my belly. I've had 3 kids. My belly could use a little bit of help. And when we were marking, we were here, the rep was with us, and she was like, oh, what about your flanks? Like, what about your inner thighs? And what about your, stuff that you just, I mean, it hadn't occurred to me all the little areas. And once you see the benefit in one area, I definitely, like you, like the kind of, I started with my belly and I moved from there. So it is interesting how kind of your goals can change over time, but the different areas that it targets very well, makes it amenable for a lot of different situations. Now we have a couple more questions. Let's see. Other fat procedures that we do in this office. So we also do liposuction, which is a very common treatment for a lot of the areas that we've just discussed. Liposuction of small areas we do in the office under local anesthetic, so something like a submental area, small areas of the axillary fat or inner thighs can be done in the office under local. If it's larger areas or more than 2 small areas, then I would do that in the operating room under anesthesia. So liposuction is common. The other thing is direct excision. A lot of people have skin that's not amenable to just fat reduction, and so without removing the skin, we can't effectively make the contour change that patients are looking for. So in those cases, it's a direct excision, meaning an arm lift or a thigh lift or an abdominoplasty. Sometimes kind of the postpartum things that happen to an abdomen, or someone who's lost a whole lot of weight, like more than 50 pounds, sometimes that skin just doesn't have the capacity to shrink up enough, so we do direct excision. So those are the other procedures for fat reduction. Really good question about Kybella versus CoolSculpting under the chin. I think they both work really well. Both of them are meant to target that specific area, kind of depending upon the shape of the fat that's there and the volume of the fat. We can help you to decide whether the Kybella or CoolSculpting is better. The way that CoolSculpting works is the fat actually has to, the area of target actually has to fit into the handpiece. I don't know if you can give me the little blue thing for the chin. And I can show you what I mean. I mean, the great part is it works so well. The part, because it works so well, we have to be very careful where we put it. And we have to make sure that the area that we're targeting fits the area that we're freezing, because we don't want to have contour irregularity. So for a submental area, the fat can fit, right underneath the chin. On some people, it could be, 2 areas. On some people, it's, 2 areas, kind of anterior, posterior. But it has to fit well. If it doesn't fit well, then CoolSculpting is not the right way to do it. In that case, we would choose either liposuction or Kybella. The approximate cost of CoolSculpting, I'm going to have Ashley bring me some numbers because I don't have the numbers on the tip of my tongue, but she definitely does. Someone asking, they had a tummy tuck. Is this a procedure that could complement tummy tuck? Absolutely. So it can be, this really can be a treatment for any part of the body, but certainly an abdomen after tummy tuck is amenable to CoolSculpting if there's still significant fat volume there. So as far as pricing, basically the more cycles that you get, the further decrease in cost per cycle. So 1 cycle starts at $750. If you have 4 cycles, it's $2,700, so you're saving $300. If you have 10 cycles, it's $5,000, so you're saving $2,500. So it's not $750 per cycle every cycle. The first one is, and then incrementally it goes down per cycle as you get up in the number of cycles. Hopefully that answers the cost question. We do not use all therapy. That's another question. Let's see if I can see this one. Question about all therapy. Oh, so for tightening the skin itself, what we're using is something called the ThermiTite. It's a radio frequency probe that actually goes underneath the skin to tighten the skin from the undersurface. For the neck and face, there's actually an entrance point underneath the chin and behind each ear. The neck and face area is infiltrated with a fluid like we would use for liposuction, and the probe is entered underneath the skin to heat it from below, and that tightens the skin much more effectively than any of the treatments that we've been using, on the external surface to tighten the skin. So for necks, chins, and jowls, that's our non-invasive treatment. It's called the ThermiTite. That's done in the office under local anesthetic. For face and neck, it takes about an hour and a half. It's surprisingly not painful for most people. I mean, Sarah and I, when we first started doing it, we're like, doesn't that hurt? And like, it really hasn't seemed to bother anybody. People walk in, we talk to them while we're doing it for an hour and a half, and when they walk out, they're a little swollen, a little bruised, but really not in any pain. Similar to CoolSculpting, a lot of the non-invasive treatments, they work really well, but they're not the instant gratification that we would all love to have. It would be nice if you could have your CoolSculpting and walk out of here and put your bikini on tomorrow. It just doesn't work like that. There's some swelling, and then there's time for your body to absorb the fat cells. And same thing with the tightening mechanisms, is that we're relying on our collagen production and all that cellular activity to occur. So kind of the final results for a lot of non-invasive things are a minimum of 3 months. And on the outset, some of them take 4 to 6 months to see your maximum result. So it's non-invasive, but it's not quick to your result time. When I operate in hospitals, I have privileges at Mercy. Mostly I'm at Mercy 4th Street. That was one of the questions. And is there a difference in price between large and small hand pieces? No, a cycle is a cycle. Oh, there is. Is there a difference? The larger one is, Okay, the Cool Advantage, which is about 3 times the size of the smallest one, is like 2 cycles. Sorry about that. I told you, you can ask me anything except for pricing in this office, and I'll know the answer. Pricing, I don't usually know. So the larger handpiece is more expensive. The smaller ones are all the same. Do you wear compression garments afterwards? Not necessary. Some people feel like it's more comfortable, but really not necessary. I'll tell you, when I had my abdomen and flanks done, I didn't feel comfortable running, and I can't say that it hurt, but just kind of that skin moving felt, I don't know, it wasn't even uncomfortable as in pain, but just weird, I guess. I don't know, like it just felt bizarre to me. And so I think compression for exercise maybe would make things more comfortable, but there's no evidence that helps people absorb the fat more quickly. Compression on the thing that we just talked about for the neck, the thermi-tight, yes, we do have people wear compression afterwards because it's an under the skin procedure and there's more swelling. But for CoolSculpting, no compression is required. These are really good questions. Let's see. I think we're up to date on the questions for the moment. Unless anyone has anything else. Anything that you guys want to add about your experience, or you don't have to. Just yeah.
Yeah, it's pretty quick and convenient.
Yeah.
Here for an hour.
Yep.
Is that last one?
Yeah.
About an hour?
Probably from beginning to end about an hour.
Yeah.
Yep.
And I did wear loose fitting shirts
Yep.
for a little bit because of the swelling,
Mm-hmm.
but I really didn't think that it affected my daily living
Yep.
in any way.
Right. Yeah, there is no limitation in physical activity or anything. There's nothing, you don't have to change any of your medications. There's nothing, that you have to avoid from a nutritional standpoint or medication standpoint. People don't get bruising, those kinds of things. Sculpture. So CoolSculpting, how CoolSculpting is different. I think that the difference of CoolSculpting is that it's targeting, because we're drawing the fat into a handpiece, like we know exactly which area we're treating and exactly what percentage of that fat we're going to get rid of. So I think as far as contour changes, I mean, we all think, oh, I want to get rid of as much fat as I can, and actually that's not true. I mean, if you don't want to have a negative deformity. I mean, if you have a divot where we put one and it's not where you wanted one, you're going to end up looking worse rather than better. So I think being able to control the amount that you're going to remove each time that you place the handpiece is important. The safety record is really high. There haven't been any adverse events. It's just normal cellular metabolism for your body to be able to dispose of these cells that are no longer living. It's a normal process that happens in your body, every day. So it's very safe and very reliable. That's how my reason for choosing this technology specifically was for safety and reliability. Let's see what else. I keep thinking we're going to be done with questions, and then there's another one. I think that might be it. Yeah, if we don't have any other, oh, here we go. Multiple treatments, yes. So here's a question about multiple treatments. So depending upon the volume of whatever area it is we're treating, for example, if we look at, if we talk about one of the pictures of an abdomen that we saw earlier, if there's a lot of adiposity in the abdomen, yes, it's going to take more than one treatment. If you can imagine whatever the volume is that you're concerned about, and each time we apply that applicator to that location, you're only going to lose 20% of the fat. 20% could be a lot, depending upon what that pocket looks like. But if there is a large amount of fat there, then it could require multiple treatments in the same area. And each time you're going to get that 20% reduction. So if you want to have, 50% of what you have, then yes, it's going to take more than one treatment. The first time you're going to lose 20%, and the next time you're going to lose 20% of what's left, and then the third time you'll lose 20% of what's left of that. So to get to 50% can take some time if there's a large volume of fat. There is no limit to what someone's BMI has to be or body weight. If there's an area that you're concerned about and you accept that 20% less is enough to make the treatment worthwhile, then it's a valuable treatment. So it's not just for tiny little areas and tiny little people. It's really whatever your area of concern is. And it's just a matter of how much volume you want to get rid of. So as far as the maximum number of treatments for a specific area, I guess there's not a maximum number of times you can apply an applicator to an area. I mean, in my mind, if you're going to require more than 3 treatments for the exact same area, then you might be better served by a surgical procedure, because it does become expensive if you're doing 3 rounds of multiple different hand pieces. It can get to be quite costly. And if there's that much volume, then it's possible that you could end up in a much more economical, for economical benefits by having a surgical procedure if it's one area that's fuller. So it's not that there's a limit. It just, the goal is to get you to a satisfied place. And if you have to be in here that many times for one specific problem area, you might be happier with the surgical option that would get you there in one shot. That's kind of the beauty of the technology. Surgery is not for everybody. Like the number of people who come in here and they want to look like they've had a facelift, but people don't really want to have a facelift. They want to have everything that they can have to make them look as good as possible without having surgery. And this is just another component to add to the non-invasive. So the question is, if someone had liposuction of the abdomen and now she has a belly that looks like she's pregnant, probably that's related to the musculature underlying the fat on the abdomen, especially if she has had pregnancies in the past or has lost weight in the past. Sometimes those abdominal muscles, the rectus muscles, when we're young and healthy and haven't had any kids, they're right together in the midline, and after pregnancy they can be not next to each other but separated rather than midline. And that space between the 2 muscles can make the belly still look like it's a pregnant belly because there's a large weakness between the muscles. In a case of that, we call that rectus diastasis, when the muscles are not properly aligned, and that is definitely not a CoolSculpting candidate nor a liposuction candidate, because removing the volume isn't going to make somebody feel more comfortable. It's really changing that contour by addressing the musculature, and that's an abdominoplasty, which is a surgical procedure that's done under general anesthesia. So abdominal wall laxity, in the case of a postpartum deformity or a massive weight loss patient, is best addressed with an abdominoplasty. A tummy tuck surgery is a better way to get to a more desirable result. So the underlying musculature does make a difference. And that brings up the point, if someone has a large abdominal weakness or specifically a hernia, then they're not a candidate for CoolSculpting treatment. So it has to be someone who has an intact, healthy abdominal wall. That's a really good question. Let's see what else. Is she getting near the end? Or we're done? She's up. So
She's on one side.
So one side is done. So the beauty of having 2, obviously one was placed, then the other was, her right side was placed first, so that's finished first. As soon as the treatment is done, the applicator is removed, and you can see what Katie is doing back there is massaging. I actually think the massage part is a little bit uncomfortable. I don't know what you think about that, Michelle.
No, I really can't feel it.
Yeah, it's numb. It's not. It can be numb or it can be a little bit irritating. But the goal is actually to break up that fat, and so she's getting a massage right there for 2 minutes. And if it's all timed right, then this one will come off in another 2 to 5 minutes, and she'll have the massage on this side, and then she'll be good to go. She'll be able to, go about her business for the rest of the evening without any extra treatment. We haven't had anyone who even has taken an Advil or a Tylenol after this procedure. Nothing like that. like I think like Michelle said, I mean, the main thing is that you're not going to want to wear a tight-fitting shirt or whatever area you've had treated, because there was a little bit of swelling in that area. But other than that, no pain and no disruption in your life, really. So she'll walk out of here, and I don't know what she has planned for dinner tonight, but. So here's a good question. Is it beneficial to have a professional massage after the treatment? I would say 100% yes. I'm a big proponent of massage for just about everything. I wish everybody could have one like every week for whatever ails you, but I think definitely it just makes sense that you're trying to get rid of basically the waste products of your cells, similar to any type of massage. And it just makes sense. You're increasing the blood flow, and you're going to get everything moving quicker. So yes, I'm a big proponent of massage in general. Is doing bilateral flanks considered 2 cycles? Yes, everywhere that a handpiece is placed is considered a cycle. So if it's, right and left flank is 2 cycles. If you need the front of the flank and the back of the flank, then that could be 4 cycles. And again, it depends upon the size of the area and how well it fits a certain handpiece. But basically, each time an applicator is placed, that's considered 1 cycle. And it is, depending upon the size of the person, an abdomen, it could take, multiple cycles to treat the whole abdomen. If it's a larger abdomen, it could take, 4 to 6 applicators to cover all of the areas of concern on an anterior abdomen. Or on a really, small person with 1 small pocket, it could be one cycle with 1 applicator. So it just depends on the target area. How's the massage going?
Good, good. Now that she's finished on the right side, it does feel a little uncomfortable.
It's like stinging, right? Like a little.
Yeah.
Yeah, just a little.
I didn't take Tylenol, or I didn't take anything.
Yeah.
But if this were to continue, maybe I wouldn't mind taking a little bit when I get home.
Right, if it lasted longer. I think because it's only 2 minutes. It's like moderately uncomfortable for 2 minutes, and then it's done. Let's see what else we can answer. I think that's it. I'm trying to think what else I can tell you about CoolSculpting. See. Somebody had questions about extra underarm, skin of the upper arms. That's another place that same technology, the ThermiTite technology, can be used. In addition to the face and neck, it can be used in the upper arms. It can be used in the abdomen. It can be used in the thighs. It's also more and more commonly being used for a small breast lift. If people have just a little bit of sagginess of the skin, it's used to tighten the skin in those areas. So that's a non-invasive way to help the skin tighten.
And there can sometimes be bruising.
With the CoolSculpting, yeah. Sometimes we do see bruising with the placement of the vacuum. Yeah. All right. I think we're good to go. If there's no more questions, we could do our drawing and see who wins the cycle. And what I'll do is just say the initials so that it doesn't have to be public information, and then we will email you to let you know that you've won. And the winner is SS. So SS, you will be getting an email from Ashley about your free cycle, and we invite all of you in for your free consultation. I think you'll find everybody here very approachable, will make you feel very comfortable about whatever your concern is, and help you come up with a solution for a good treatment plan for your goals. And I hope everyone has a good evening. Thank you so much for joining us, and next month we are going to be discussing skincare with Katie, and I think we're going to be doing a peel during the webinar. So it's fun sharing our expertise and enthusiasm with you, and we look forward to the next time. Thank you very much.
I'm not really sure.